I've gathered all my supplies. I have my suction kit. I have sterile water, sterile gloves in here, my pulse ox, and my stethoscope. Hello, I'm Miko McDowell. I'm going to be your student nurse today. I'm going to practice hand hygiene. I can tell that you're having some problems talking, so do you mind if I look at your wristband to identify your name and date of birth? All right, John Smith, born May 5th of 1961. Okay, so first I am going to raise your breath to semi-Fowlers, and I'm going to maintain patient privacy. Okay, first I am going to listen to your lung sounds. I'm going to listen to them anteriorly. Now I'm going to listen to them laterally. All right, can you lean forward for me so I can listen to them posteriorly, please? All right, I'm going to go ahead and apply this pulse ox to your index finger. Okay, so I heard some adventitious breath sounds. I can also tell that your cyanosis, which indicates that you're having trouble with having some oxygen. And also, I can see copious amounts of secretions in your tracheostomy, and your pulse ox reads 88%, which is a little bit less than what we want. So I'm going to go ahead and we're going to turn on the suctioning. We're going to suction your tracheostomy for you. So I'm turning it up to 140 millimeters of mercury. Okay. And now I'm going to put on this clean glove. And I'm going to check and make sure the suctioning is working. All right, so we know that that's working. I'm going to go ahead, throw away this glove. I'm going to practice hand hygiene. Okay, so we're going to be performing a tracheostomy suctioning. So we're just going to take this section and attach a sterile tubing to it and get some of those secretions out to help you breathe a little bit better, all right? Okay. So we're going to go ahead and get started. I'm going to take our suctioning kit and start preparing that. I'm going to maintain a sterile field. And I'm only going to touch the outer border, 1 inch of the outer border. Okay, I'm going to apply this first sterile glove. And I'm going to go ahead and set up this container here. This is going to contain our sterile water, which I am going to go ahead and pour. Be careful to keep that sterile. All right. Now I'm going to take my sterile glove and apply this on the other side. Be careful to only touch like this. All right. So now I'm going to get this tubing with my sterile hands. All right. So I'm going to be careful and keep it in my dominant hand, having some nice control. All right. So now I'm going to take my non-dominant hand and I'm going to go ahead and contaminate it by connecting the suction to our tube here. All right. So now I'm going to suction some sterile water in here. And also I hyperoxygenated you to prepare you for this procedure. Okay, so I've suctioned some sterile water. Now I am going to remove your trach collar. I'm going to quickly and gently insert the tube about 5 inches into your tracheostomy, and now I'm going to occlude for no longer than 15 seconds in a circular motion. All right, now I'm going to pull out, and I'm going to occlude some more, get some sterile water. I can see some yellow mucousy secretions, a copious amount. So I'm going to go ahead and do one more pass. I'm going to give it about 30 seconds in between. Okay, now that it's been about 30 seconds, I've put some sterile water through our tube. We're going to do another pass, about 5 inches. Now I'm going to suction, circular motion. All right, now longer than 15 seconds, I'm going to replace your oxygen collar. And now, I'm gonna rinse it out. All right. It looks like you're able to breathe a little bit more. There's no signs of cyanosis or any shallow breath sounds. And looking at your pulse ox, it looks like your oxygen is back up to 96%, so that is what we'd like to see. Also, I see no more secretions in your tracheostomy tube. I'm going to lower your bed, and I'm going to make sure the wheels are locked. And also, I am going to put this call light in place, so if you need me, you can call using that light. And I'm going to position your bed in a comfortable position. Okay, and if you need anything, just let me know with the call light. And I'm going to go document now, but I will come back to reassess you.